Preterm births affect families in every country. While more than 80% of preterm births occur in Asia and sub-Saharan Africa, Zambia inclusive. The problem is universal. Preterm birth is the leading cause of death in children under the age of 5. Each year, about 15 million babies worldwide are born prematurely. That is about 1 in 10.
So a premature baby is any baby who's born before 37 completed weeks of pregnancy. Some of the complications that they face, usually they have difficulties in breathing because they have immature lungs. They also tend to be prone to infections because they have an immature immune system. They lose heat rapidly, so they also tend to have hypothermia or body temperatures that are below the normal range, as well as also glucose levels below the normal range because they have low glucose storage.
Right now in Zambia, we struggle a lot with under 5 mortality. Of course, there have been a lot of improvements, but we are still not where we want to be. Right now, we stand at 61 per 1,000 live births. That is the under 5 mortality. And what is very sad is that most of the children, up to about 2/3 of them, die before they reach their first birthday. Another category of babies that die silently. These are stillborn babies, and traditionally we don't mourn these babies. So there are a lot of babies who die like this, and they have gone without anyone even remembering them, and they don't even have names to make things worse. So these are some of the things that we're trying to work around as Ministry of Health.
At Levi Mwanawasa University Teaching Hospital, about 6,000 deliveries are conducted every year, and about 1,000 of them are admitted to the neonatal intensive care unit. Out of the 1,000 admissions, 32% are born prematurely with weights less than 2,500 grams.
Levi was opened in 2011. A year later, in 2012, we opened our NICU services. And in 2021, we started offering Kangaroo mother care. On average, at least yearly, we see a total of about 6,000 deliveries. And out of these, about 1,000 admitted to our NICU, giving us about 32% being prems, premature babies. And we've had a mortality rate, as of today, about 26%. So we have the KMC, the skin-to-skin that we offer, as well as incubators, and we have some radiant warmers as well, which would be required to help with the hypothermia. In terms of the difficulties in breathing, the preterms usually require ventilators or what we call CPAP, and to help with the low sugar levels. So the KMC, the frequent feeding they undergo, helps maintain the sugar levels, as well as syringe pumps and some feeding pumps as well.
This year for World Prematurity Day, we are raising awareness about Kangaroo mother care with a global call to action under the theme, A Parent's Embrace, a Powerful Therapy, enable skin-to-skin contact from the moment of birth. Kangaroo mother care is a technique where the baby is placed in skin-to-skin contact between the mother's breast on a bare chest. So the baby is secured and then it's covered with warm clothing. The benefits for this practice are many. So there's improved breastfeeding, bonding, and also warmth. This also gives an opportunity to the mother to hold the baby, massage the baby, talk to the baby, and even sing. So this has a positive impact on the brain development. It also gives peace of mind to the mother.
I've had an amazing experience at the UTH Kangaroo Mother Care ward. My baby was born at 31 weeks, and this ward has really helped me with so much information. I've learned about how keeping the baby on my skin when we do skin to skin, which is actually kangaroo care, and that warmth helps the baby to not use the little food that it's actually getting to create warmth, to keep its own body warm, but instead it uses that the food to actually create fat, so it actually starts to gain weight. That's because the mother is providing heat for the baby, warmth for the baby from her own body. Another benefit that I've seen is that it's helped me to bond with my baby. I'm able to observe my own baby. I can tell if he's still breathing, if he's having any kind of discomfort. Just observing whether he's hungry and things like that, because if there's anything that is worrisome or I need to address with the doctor, it's easy for me to actually observe that because he's on my body and I'm right here with him. I can feel his warmth, I can feel whether he's getting cold and things like that. So it's been very, very beneficial for us. Now that I've been given these skills, I have confidence to actually go home with my child, because this is more like a transitional ward where we are trained and we're given the skills to go and be able to take care of our children when we go home. And the big thing I'm going to make sure I do is that I also train my husband and give him this information and knowledge so that he understands the benefits for our son and he'll be able to do it.
Simple, but with endless benefits. Skin-to-skin contact can reduce neonatal mortality by 40%, can improve bonding with the baby, increase breast milk supply, and increase confidence in the ability to care for the new baby.